Welcome to our training session on ADLs and IADLs. ADLs are activities of daily living, like bathing and dressing. IADLs are instrumental activities of daily living, such as cooking and managing finances. These tasks are essential for independence and daily structure. Understanding them helps caregivers identify where support is needed most. Assisting with daily tasks is a profound act of care. Safety is our guiding principle to protect both the person receiving care and the caregiver. Risks like slips, falls, and strains must be minimized. Using safe methods and techniques is essential for everyone's well-being. Safe practices build confidence and promote trust. ADLs are fundamental self-care tasks we perform daily. They include actions like bathing, dressing, and eating. These tasks are vital for personal independence and well-being. Assessing ADL performance helps understand an individual's ability to live independently. Paying attention to ADLs allows for early identification of needs and timely interventions. Bathing is a fundamental ADL for maintaining hygiene. Safety is crucial due to the risk of slips and falls in the bathroom. Prepare the environment with grab bars and non-slip mats. Approach bathing with sensitivity and respect for privacy. Offer choices to help the person retain a sense of control and dignity. Dressing involves selecting appropriate clothing and managing garments. It contributes to self-esteem and social presentation. Offer choices to respect preferences and promote self-identity. Toileting addresses fundamental biological needs and requires empathy. Approach with sensitivity to maintain dignity and comfort. Eating is a life-sustaining ADL involving the use of utensils and safe swallowing. Assisting with eating requires patience and attention to safety. Transferring involves moving from one surface to another, requiring strength and coordination. Proper techniques and assistive devices prevent injury. Mobility is essential for independence and overall well-being. IADLs involve complex tasks for independent living. They include meal preparation, housekeeping, and managing finances. Understanding IADLs provides a broader picture of functional abilities. These tasks require planning, organization, and interaction with the environment. Identifying IADL needs allows for a nuanced approach to care. Meal preparation involves planning cooking and safe food handling. Encourage involvement to maintain skills and promote contribution. Safety in the kitchen is paramount to prevent accidents. Housekeeping includes cleaning laundry and maintaining an organized home. A tidy living space supports physical health and psychological comfort. Using the telephone is critical for communication and safety. It involves dialing, answering, and emergency use. Shopping includes planning, budgeting, and navigating stores. Online shopping requires digital literacy. These IADLs ensure access to essential supplies and social connections. Managing medications involves correct identification, dosage, and timing. Organizing medications and refilling prescriptions are crucial. Assisting with medication management requires careful attention and adherence to care plans. Financial management includes paying bills, budgeting, and avoiding scams. Good financial management prevents stress and instability. Effective communication is truly the cornerstone of providing safe and respectful care. It's more than just speaking. It involves listening and understanding. When assisting with ADLs and IADLs, clear communication builds trust. It helps the person feel informed and involved in their own care. Always take the time to explain what you are going to do. Do this before you begin any task and continue to communicate throughout. Use simple, clear language that the person can easily understand. This proactive approach can significantly reduce anxiety and confusion. It fosters a cooperative spirit between you and the person you support. Think about how you would feel if someone started performing personal tasks for you without explanation. You might feel startled, vulnerable, or even resistant to the help offered. By clearly stating your intentions, you empower the individual. For example, before assisting with bathing, you might say, "I'm going to help you wash your back now, is that okay?" Or, "The water is warm, and I have the towel ready for you." This allows them to prepare mentally and physically for what is happening. It respects their autonomy and personal space, even when assistance is needed. This simple act of explaining shows consideration and deep respect. Empathetic communication goes hand in hand with clarity. This means trying to understand the person's feelings and perspective. Pay close attention to their verbal and nonverbal cues. Do they seem hesitant, uncomfortable, or perhaps in pain? Acknowledge their feelings gently. "I see this might be a bit uncomfortable. We can go slowly." This shows you are attuned to their experience and care about their comfort. Your tone of voice should always be calm, patient, and reassuring. Remember, needing help with personal tasks can be emotionally challenging. Your empathy can make a profound difference in their experience of care. Creating and maintaining a safe environment is a fundamental aspect of caregiving. This is especially important when assisting with ADLs and IADLs. Many tasks like bathing or meal preparation have inherent risks if the surroundings are not safe. A cluttered room can lead to trips and falls, a common hazard. Poor lighting can make it difficult to see obstacles or perform tasks accurately. Wet floors, particularly in bathrooms or kitchens, are a significant slip risk. Your role includes being proactive in identifying and mitigating these environmental hazards. A safe space is the foundation upon which safe care delivery is built. Before beginning any care task, take a moment to assess the immediate environment. Look for potential dangers like loose rugs, trailing electrical cords, or spills on the floor. Ensure pathways are clear and unobstructed, especially for individuals with mobility challenges. Good lighting is essential in all areas, so replace burnt-out bulbs promptly. In the bathroom, check that non-slip mats are in place and grab bars are secure. During meal preparation, keep countertops clean and free of unnecessary items. These small, consistent actions significantly reduce the risk of accidents. They contribute to a sense of security for both you and the person you care for. Cleanliness is intrinsically linked to safety and well-being. A clean environment helps prevent the spread of infections and promotes good health. This is particularly critical for tasks like meal preparation and personal hygiene. Ensure kitchen surfaces and utensils are thoroughly cleaned before and after use. Store food properly to prevent spoilage and foodborne illnesses. In personal care areas, maintain high standards of hygiene. Regularly clean commodes, shower chairs, and other equipment used. A clean home also contributes to a more pleasant and dignified living experience. It shows respect for the person and their personal space. Adaptive equipment promotes safety and independence. These tools make daily activities easier and safer. They help overcome physical limitations. Examples include grab bars for stability. Shower chairs provide a secure place to sit. Walkers and canes offer support and balance. Reachers help retrieve items without bending. Proper use is a key caregiving skill. Therapists recommend and instruct on use. They assess needs and provide guidance. Follow instructions for correct use. Ensure equipment is in good working order. Check for wear or damage. Ask for guidance if unsure. AFC nurses can provide training. Incorrect use can be dangerous. Adaptive equipment enhances safety and independence. It promotes independence and self-esteem. Raised toilet seats aid in toileting. Specialized utensils help with feeding. These tools reduce the need for assistance. They boost self-esteem and control. Encourage use as prescribed. Gentle encouragement helps. Highlight the benefits. The attentive eye. Observing and reporting changes in condition. A crucial part of providing safe care is being an attentive observer. As a caregiver, you often spend significant time with the person you support. This puts you in a unique position to notice subtle changes in their condition. These changes might be physical, emotional, or cognitive. Early detection of such changes can lead to timely interventions. This can prevent minor issues from becoming more serious problems. Your observations are vital pieces of information for the entire care team. Developing a keen sense of observation is an essential caregiving skill. What kind of changes should you be watching for? Physical changes could include new skin breakdown, like redness or sores. You might notice increased weakness, unsteadiness, or changes in gait. Swelling in the legs or ankles or complaints of new or worsening pain are important. Changes in appetite, fluid intake, or toileting habits also warrant attention. Listen carefully to what the person tells you about how they are feeling. Even seemingly small physical changes can be significant indicators. Regularly, but discreetly, observe them as you assist with ADLs and IADLs. Cognitive and emotional changes are equally important to note. Is the person more confused or forgetful than usual? Are they having increased difficulty with familiar tasks or communication? Notice any changes in mood, such as increased irritability, sadness, or withdrawal. Are they showing less interest in activities they previously enjoyed? Sudden changes in behavior or personality should always be taken seriously. These shifts can sometimes indicate underlying medical issues or emotional distress. Your calm and consistent presence can help you identify these nuanced changes. Fostering dignity and independence. The art of assisting wisely. Promote independence by encouraging them to do as much as they can safely. This respects their abilities and maintains their skills. Offer support only for tasks they genuinely cannot do. This boosts their self-esteem and sense of purpose. Always ask for permission before assisting with personal care. Ensure privacy and dignity in every interaction. Speak respectfully and maintain a professional demeanor. These actions create a trusting and comfortable care environment. The spirit of enablement. Why independence matters most. Promoting independence is not just a helpful technique in caregiving, it is the very essence of truly person-centered support. This philosophy places the individual and their remaining abilities at the forefront. It acknowledges that every person, regardless of their needs, possesses inherent worth. Our primary goal shifts from simply doing for someone. Instead, we focus on enabling them to do for themselves. This subtle but powerful shift transforms the care experience. It makes our assistance more meaningful and deeply respectful. Think about the deep human need to have some control over one's own life. This need does not diminish with age or illness. When we actively support a person's independence, we honor this fundamental need. We help them maintain their sense of self, their identity. Even small acts of self-care, when performed by the individual, are victories. These moments contribute to their overall well-being and spirit. They reinforce that they are still capable and valued members of our community. This approach moves beyond tasks to touch the person's core dignity. Focusing on what a person can do, rather than what they cannot, is key. Every individual has unique strengths and capacities that can be nurtured. Perhaps they can hold a fork even if they need help cutting food. Maybe they can choose their outfit, even if dressing is challenging. By identifying and encouraging these abilities, we build their confidence. We help them experience success and maintain a positive self-image. This strengths-based perspective is empowering for the person receiving care. It also brings greater satisfaction to you, the caregiver. Empowerment in action, offering meaningful choices daily. Offering choices is a practical and powerful way to promote independence. It allows individuals to exercise control over their daily lives. Even small choices can have a significant impact on a person's sense of self. It reinforces that their preferences and opinions still matter greatly. When a person feels they have a say, they are more likely to engage. They become active participants in their care rather than passive recipients. This collaboration fosters a stronger, more trusting relationship between you. It transforms routine tasks into opportunities for empowerment. Consider the many ADLs and IADLs where choices can be offered. During dressing, ask, "Would you like to wear the blue shirt or the red one today?" At mealtimes, inquire, "Would you prefer tea or coffee with your breakfast?" When planning activities, you could say, "Shall we take a short walk now, or perhaps later this afternoon?" These simple questions transfer a degree of control back to the individual. They affirm their personhood and respect their right to choose. Always provide genuine options that you are prepared to honor. This makes the act of choosing meaningful and real. It is important to offer choices that are appropriate for the person's cognitive ability. For someone with memory challenges, too many options can be overwhelming. In such cases, offer a simple choice between two items, this one or that one, while showing the items can be very effective. Observe their responses, both verbal and nonverbal. Sometimes a gesture or facial expression can indicate a preference. The goal is to make the process of choosing feel successful and not frustrating. Adapting your approach ensures that offering choices remains a positive experience. Honoring individuality, personal preferences, and life stories. Every person we care for has a unique history and a set of personal preferences. These are the threads that make up the rich tapestry of their identity. Honoring these individual aspects is crucial for maintaining their dignity. It shows that we see them as a whole person, not just a set of care needs. Take the time to learn about their past routines and what they enjoy. What time did they usually wake up or have their meals? What are their favorite foods, music, or activities? Knowing these details allows you to personalize their care significantly. Integrating personal preferences into daily ADLs and IADLs can make a big difference. If someone always enjoyed a particular brand of soap, try to provide it. If they have a favorite mug, ensure it is available for their morning drink. When assisting with dressing, consider their usual style and color choices. These small gestures of thoughtfulness can make them feel more comfortable. It helps them feel more like themselves, even when they need assistance. It shows that you respect their lifelong habits and personal tastes. This continuity can be incredibly comforting and affirming. A person's life story holds immense value and contributes to their sense of self. Encourage them to share memories and stories if they are willing and able. Listen with genuine interest and respect. Photos, keepsakes, or favorite objects can often spark conversations. These items can serve as important links to their past and identity. Incorporating these elements into their environment can be very positive. It helps create a space that feels familiar and reflects who they are. This connection to their personal history is vital for emotional well-being. Words that uplift communication that affirms dignity. The way we communicate with individuals plays a critical role in upholding their dignity. Our words, tone of voice, and body language send powerful messages. It is essential to use language that is respectful and age-appropriate. Avoid using patronizing terms, baby talk, or overly familiar nicknames unless invited. Address the person by their preferred name, such as Mr. Smith or Mrs. Jones, or their first name if they prefer. This simple courtesy shows respect for their adult status and individuality. Speak clearly and at a moderate pace, allowing them time to process. Ensure you have their attention before you start speaking. Active listening is a cornerstone of communication that affirms dignity. This means truly paying attention when the person is speaking. Make eye contact, nod, and provide verbal cues that you are engaged. Listen not just to the words, but also to the underlying feelings. Validate their emotions even if you don't fully understand or agree. For example, you could say, "I can see that this is frustrating for you." This shows you are trying to understand their perspective. Feeling heard and understood is incredibly important for a person's self-worth. Nonverbal communication is just as important as the words we use. Maintain a calm, open, and friendly posture. Approach individuals from the front, at their eye level if possible, especially if they are seated. A gentle touch, if appropriate and welcomed, can convey warmth and reassurance. Be mindful of your facial expressions. Aim for a pleasant and empathetic look. These nonverbal cues can greatly influence how your message is received. They contribute to a feeling of safety, trust, and respect. Your entire presence should communicate care and consideration. Navigating autonomy and safety, a delicate, respectful balance. One of the most challenging aspects of caregiving is balancing autonomy with safety. Individuals have the right to make choices about their own lives. However, sometimes their choices might seem to pose a risk to their safety. For example, a person might want to walk unaided despite being unsteady, or they might refuse a particular assistive device that could prevent falls. This creates a dilemma for caregivers who are responsible for safety. It is a delicate balance that requires careful thought and communication. Our goal is to respect autonomy as much as possible while ensuring safety. Open and honest communication is key when navigating these situations. Try to understand the reason behind the person's choice or refusal. Perhaps the assistive device is uncomfortable, or they feel it makes them look old. Listen to their concerns without judgment. Gently explain the potential risks associated with their choice. Provide clear information about why a certain safety measure is recommended. Focus on the benefits to their well-being and independence in the long run. For instance, using your walker helps keep you steady so you can continue to enjoy your walks. Involve the person in problem-solving whenever possible. Ask them for their ideas on how to make a situation safer. What do you think would help you feel more secure when you walk to the bathroom? Collaborating on solutions can lead to greater acceptance and cooperation. It empowers them and shows that their input is valued. Sometimes, a compromise can be reached that respects their wishes while mitigating risks. Always document these discussions and decisions according to your agency's policy. Consult with your AFC nurse or case manager for guidance in complex situations. The Caregiver's Shield. Understanding good body mechanics. Good body mechanics are your shield against injury. They help you use your body correctly and safely. Essential for lifting, transferring, and assisting. Protect your muscles, joints, and back. Prevent injuries and ensure a long, healthy career. Safe caregiving starts with a safe caregiver. A foundation of strength. Standing close and bending your knees. Stand close to the person or object you are moving. This gives you better control and reduces strain. Always get as close as safely possible. Bend at your knees, not at your waist. Use your strong leg muscles for lifting. This prevents back injuries and ensures safety. Core protection. Maintaining a straight back and engaging muscles. Keep your back straight, maintaining natural curves. Avoid rounding or arching excessively. Align ears, shoulders, and hips. Engage core muscles to support your spine. This stabilizes your body during movement. A strong core reduces spinal load. Essential for every caregiver every day. Smart movements. Avoiding twists and using both hands for stability. Avoid twisting your body, especially your back, while lifting. Twisting can lead to serious back injuries. Keep your shoulders aligned with your hips. Pivot your feet to turn instead of twisting. Use both hands for stability and balance. This provides a stable base and better control. Your back will thank you for it. Wisdom in action. Recognizing limits and using essential aids. Ask for help when needed. Recognize your physical limitations to avoid injury. Use assistive devices like gait belts, slide sheets, and mechanical lifts. These tools reduce strain and ensure safe, comfortable transfers. Proper training on equipment use is essential for smart caregiving. Embracing excellence in care. A summary of vital practices. Our journey through safe ADL and IADL assistance is now concluding. Remember, your work is incredibly important and deeply valued. Assisting with daily life requires skill, compassion, and constant awareness. Safety for both the member and yourself must always be your guide. These principles are the heart of truly excellent care. You are making a real difference in someone's life each day. Thank you for your unwavering commitment to providing outstanding care.